Hi, everybody. My name's Ben. I am a mental health therapist working at Link Therapy in Portland, Oregon. And today I wanted to talk a little bit about something that I've noticed as a clinician that has come up that really gets undertreated and it kind of goes under the radar for a lot of people. And that is sleep health and insomnia. Huge issue. I mean, anybody who has insomnia will tell you that it is not something to be ignored. It is a huge drain um, on your energy during the day. It contributes to things like depression and anxiety and makes everything harder. Sleep is so important. It's easy to sort of look past that part of the day where we're not even conscious, right? But like, it's huge. It's very important. So to start out, I want us to think a little bit about a scenario. And as we go along, keep in mind any of this that kind of resonates with what's going on for you in terms of sleep. So imagine it's been months and months of crappy sleep that has just been night after night of every time you think about going to bed, it's like a spike of anxiety. There is like, you lay in bed thinking about how rough the next day is going to be. And that's just getting your heart rate going and making it harder to fall asleep, which is spiraling, right? It happens. And you've tried everything. You have done the sleepy time tea. You looked up tips for sleep hygiene and all these things, right? And it's not enough. It doesn't work. It's so frustrating, right? And then maybe you go see a doctor and they might refer for some things and they might give you a sleeping pill. And I know that for a lot of people who have dealt with insomnia for a long time will tell you that like sleeping pills can be helpful. And they are generally, though, a Band-Aid. They are, a short-term fix. They're not going to sort of resolve the underlying issue. Maybe you even get a sleep study done. And here's something that can be really frustrating that I know some people have experienced. Maybe your sleep study results are great or decent. You have a good amount of REM sleep and things are looking good. So, maybe just keep trying or keep taking those sleeping pills if you're having a bad night. So frustrating, right? You've done all this work, nothing is working. It's really hard not to think like, is my body broken? Is my mind, what is wrong? It can get pretty negative and kind of at a place where you're blaming yourself. And like, it's hard not to. So I think that is an issue that like this treatment called CBT-I can come very much in handy. It's a form of therapy that I've been trained in, and it's kind of a combination of a couple of things. Some of the best sleep science and resources in that side of things to help kind of guide how to proceed around insomnia. But it's also incorporating cognitive behavioral therapy. That may be something you're familiar with, maybe not. But the basics of it is that in terms of the cognitive side of things, this is a therapy that's used in anxiety, depression, trauma, all these things. And something that's really helpful for it is addressing these beliefs about ourselves or about our circumstances of like, this is never going to get better. I am always going to be like this. I'm terrible. My body is terrible. All these thoughts, right? Like it can get really negative in a lot of different ways, and certainly with sleep being one of them. So that's something that can be addressed within CBT. And then in terms of the behavioral side of things, what we're talking about is like making some habit adjustments and things like that. I will say that in CBT-I specifically, the sort of specialized treatment for insomnia, it is intended to be a short-term treatment. It is can be as short as just a few months. And the sort of habit adjustments that we'll be making, if you were to come in and see me as a therapist, would be short-term as well. It's kind of the intention behind these changes is to kind of give a jolt to your sleep system and reset it. And so that's something to keep in mind as we think about, like, obviously making habit changes is a challenge. It's not something that's just as easy as it seems like it should a lot of the time. But this is a short-term intervention. Ideally, once we're done with this, we're back to a point where your sleep system is functioning as it should, and you don't have to worry so much or have to think about sleeping as often. If everything goes well. So, some to give you a sense of what this looks like, right? We would start with kind of keeping a sleep diary. That's just to kind of going through a fine-tooth comb over what's going on for you in terms of sleep. We're gonna be reviewing, when you're going to bed, when you're waking up in the night, when you're getting up, all these things to kind of get the patterns of what's going on and kind of figure out the right adjustments to make. And yeah, from there, it'll be basically making sure that there aren't any of these sort of negative thoughts that are holding us back, or beliefs about sleep. There's so much kind of lack of understanding of how our sleep system works that can kind of get in the way of letting our systems function the way they should be. So if you are struggling with insomnia, if you are struggling night after night with sleep issues, feel free to reach out. If you're in Oregon, you can reach out to me at Link Therapy, linkpdx.org. Or, if you're outside of that area, you can look into practitioners of CBT-I in your area. And, if you come in, and we may be looking at some things around CBT-I, if that's appropriate, if insomnia is your issue. And maybe that some other sleep issues are coming up too, sleep apnea, or other sleep disorders, maybe part of what's going on for you. And those are things that I might be referring out to get, more specialized support or more medical support, especially for sleep apnea. And it may be in combination with our treatment. So just keep that in mind if you're coming in like, I don't know what's going on, but my sleep sucks. Don't let, if you don't know what's going on, don't worry about it. Just, find a provider like myself or someone else in your area that is going to be able to help sort through what's going on and maybe offer some real help and get you some real rest that, isn't as contingent on sleep aids and things like that. So sleep is hugely important. And I think it's time, if you're struggling with sleep, to get something done about it. So, all right. Well, thank you for listening, and I hope you have a great day.